By this point, we all know the coronavirus can be deadly to the elderly and people with compromised health, but studies now suggest that the virus may cause serious harm even to those who are young and robust. Doctors say children infected by the coronavirus could suffer brain damage without presenting respiratory symptoms in a study published in JAMA Neurology. Physicians from a hospital in London examined 27 children with an inflammatory syndrome related to COVID-19. They discovered that 4 of the patients, or 14.8%, developed additional neurological symptoms. The documented symptoms include headache and encephalopathy, muscle weakness, reduced reflexes, and signs of damage in the cerebellum and brainstem. All 4 had required intensive care. According to the study, inflammation may have affected the children's corpus callosum, a brain structure that mediates the left and right hemispheres, because they detected signal changes within the structure. While 2 of the patients have recovered, the remaining 2 are still receiving treatment as inpatients at the hospital and were wheelchair-bound at the time of publication. The authors cautioned that although the study had a small sample size, the results are enough to require close surveillance on young patients who carried the coronavirus asymptomatically. So much for herd immunity. But wait, I hear you say, didn't you guys cover this before? Well, yes and no. Chinese doctors have previously said they observed neurological symptoms in COVID patients, but these weren't children. Check this out.
In case you didn't already have enough reasons to worry about catching the coronavirus, scientists are now warning that SARS-CoV-2 may also be attacking people's brains and causing serious long-term damage. A study of COVID-19 patients in the Chinese city of Wuhan, from where the pandemic originated, found coronavirus could lead to serious neurological complications in perhaps as many as 1/3 of all patients. In the study of 214 hospitalized COVID-19 patients in Wuhan, researchers reported more than 35% had neurological complications, including decreased levels of cognition, stroke, and muscle damage. Their findings, published in the journal JAMA Neurology on April 10th, found 36.4% of those studied had neurologic symptoms. Among patients with more severe infections, 45.5% showed neurologic manifestations. Not all patients with these symptoms exhibited common manifestations of the disease, namely a sore throat, dry cough, and diarrhea. The news comes after previous reports that many COVID-19 patients experience anosmia, or the loss of smell, hyposmia, a reduced sense of smell, and dysgeusia, the distortion of the sense of taste. These reported symptoms may indicate other ways in which the coronavirus could affect the brain. Separately, France's National Union of Dermatologists Venereologists, or SNDV, has reported that certain skin dermatological conditions may possibly be associated with COVID-19 infection. In an April 6th press release, the organization said these symptoms include appearance of pseudo-frostbite of the extremities, transient hives, and sudden onset of persistent, sometimes painful redness. The SNDB recommended that patients with skin conditions of these types consult a dermatologist to rule out the possibility of COVID-19.
In June, Science magazine reported the coronavirus could actually be a blood vessel disease. This lines up with a bunch of bizarre and, frankly, terrifying symptoms that doctors have encountered, such as COVID toes.
Every day we are learning new potential symptoms of the coronavirus. This time it appears that even our toes could tell us whether or not we are infected. Researchers have observed a new possible sign of coronavirus in the body. Here's what we know so far. According to USA Today, some health professionals treating COVID-19 have noticed purple and blue lesions on the toes of coronavirus patients. This symptom is now being referred to as COVID toes and can often be observed in patients with severe flu or viral pneumonia. Ebbing Laudenbach, chief of infectious disease at the University of Pennsylvania School of Medicine, told USA Today that the symptom could be an inflammatory reaction to an infection in an individual's feet or a clot in the toes' blood vessels. Laudenbach said patients exhibiting this symptom tend to be children or young adults who are otherwise asymptomatic and would probably test negative for COVID-19 as the infection is in its early stages. However, Susan Wilcox, Massachusetts General Hospital's chief of critical care for the emergency department, told USA Today that she mostly observed COVID toes in the most severe cases she was treating. Doctors around the world have also observed other dermatological symptoms related to COVID-19. In an April 6th press release, France's National Union of Dermatologists v. Neurologists reported that certain dermatological conditions could be related to COVID-19. These include the appearance of pseudo-frostbite of the extremities, transient hives, and sudden onset of persistent, sometimes painful redness. For more news animations and explainers, hit the subscribe and bell button to join the TomoNews family. Thanks for watching.